Welcome to the Speechie Show. Being a speech-language pathologist often means having too much work and not enough planning time. To beat the overwhelm, we're bringing you the tricks and tools that will make your job a little bit easier. Hello, everyone, and welcome to the Speechie Show. I am your host, Carrie Clark from SpeechAndLanguageKids.com, and I'm here today with Erin from Your Speech Path LLC. Thank you so much for joining us, Erin.
Sure, I'm happy to be here.
Excellent. Today we are talking about where to start in therapy with your students who are deaf or hard of hearing, and we're going to share some tips today about how to get started with that, some therapy ideas, and we're going to do some giveaways here in just a couple minutes. So stay tuned. If you're here with us on Facebook Live, you'll get a chance to participate in our giveaways. All right, so we're talking about deaf and hard of hearing students today. And Erin, why don't you go ahead and introduce yourself and your experience with students who are deaf or hard of hearing?
Sure. So my career started when I saw Mr. Holland's Opus when I was a teenager and fell in love with sign language and the deaf community. So my bachelor's, I went a little bit of a different path than speech initially. My background is a bachelor's in deaf studies. I learned American Sign Language in college, and then I went to Gallaudet University in D.C. for my master's in speech language pathology. And my passion has always been deaf and hard of hearing kiddos. So it's been from the beginning, and it is my bread and butter, and I'm really excited to talk about it today.
Absolutely. Okay, so are you in private practice now or working in the schools? What are you doing?
I am. I just opened my own private practice in January. I've worked in early intervention, preschools, outpatient rehab, private practice, and now I just opened my own. So private practice is definitely my forte. I really, really love it.
Fantastic. Okay, so as we're going along today, if you are watching with us live, we encourage you to type in questions. If you have any questions about the deaf or hard of hearing community or any of the things we're talking about, go ahead and type those in the questions. And go ahead and type in right now what age group you're working with so we can make sure that we're getting you the information you want. So if you're watching with us live, type in the comments what age group you're working with. And we're going to jump in here today with 5 tips that will help you get started with treating a student who is deaf or hard of hearing. So the first thing we want to talk about is our background information. Obviously, that's always where we start as a speech-language pathologist. So let's talk about what that looks like for a student who is deaf or hard of hearing. What you got, Erin?
All right, so when you know that you have a child that is deaf or hard of hearing on your caseload, you want to do some research before jumping into therapy. We want to do this with all of our kids, but in particular with the deaf and hard of hearing kids. There's a lot of information you need to know beforehand. You want to know the age of the child you're working with. You want to know the age of onset of the hearing loss. Was the hearing loss identified at birth? Was it a late diagnosis? These are going to be really important when it comes to the therapeutic process. You want to know the degree of the hearing loss. Is it a mild loss, a moderate, a severe, or a profound? And that's going to indicate what type of amplification they're going to be using. Because children with cochlear implants have to be severe to profound. Hearing aids are likely mild, moderate, around that degree. You want to know the type of the hearing loss. So there's the degree of hearing loss, and then there's the type. So one of the types is called conductive, and that's when sound waves can't or have difficulty passing through the outer or middle ear. There's no damage in the middle ear, and this can be caused by infection of the outer ear, otitis externa, or one of the common ones we hear about all the time with our kids and our clients, otitis media, that good old-fashioned ear infection. Other things can cause a conductive loss, such as a hole in the eardrum or the tympanic membrane, trauma, such as damage, pressure in the ear surgery, infection. All of these can cause a conductive hearing loss. And then another type is the sensory neural hearing loss, and that is damage to the inner ear or the cochlea, where all of the nerve pathways from the inner ear travel to the brain, that auditory nerve. Sometimes there's damage to the hair cells in the cochlea. Sometimes there's a missing auditory nerve. And it's very important to find this out. I've had some stories where a speech therapist didn't know that there was no auditory nerve in a child. So it's very important to check this information.
That's helpful to know.
It happens, yeah. And then there's a mixed hearing loss, where there's a combination of conductive and sensory neural. And then the last thing to think about when gathering all of the background information is the age of the child when the hearing aids, cochlear implants, the Bahas were first used. I have a particular kiddo who was diagnosed at birth, but he wasn't amplified until 2 years old. So he missed those first 2 imperative years for language acquisition. So it's important to get all of that information.
Perfect. So you get all that information and you're making sure that you have all the information so that you can make decisions about what treatment will look like and what communication will look like for that student. Okay, I'm going to back up for a sec. So we have a couple people chiming in with what ages they're working with. We got a 2 to 13 and elementary age. So kind of a broad range there. If you guys want to type in what other ages you are working with, that will help us make sure we're getting you the right information today. If you're just joining us, we're talking about children who are deaf and hard of hearing and giving you some tips on getting started with those. So once we have the background information, the next thing that we need to look at is how is this child going to communicate with the world around him? So what can we do in terms of making sure the families are involved in this process, and especially for the first ones to start treatment with a child?
Mm-hmm. So it's really, really important that this is a discussion with the family. About 95% of children born with a hearing loss are born to hearing parents who may not have the knowledge or the education about what are the options for their child. I very much believe in being very forthcoming about all of the options, whether that be auditory, verbal. For the sake of this talk, I'm going to assume the child is in an auditory verbal model. But there's American Sign Language, using basic sign language. And very quickly, some people aren't aware that American Sign Language is its own language. It has its own syntax. It's different than what a lot of people do with their kids signing exact English. So that's important to differentiate. Then there's other manual systems such as cued speech. That's another manual visual system of communication. It's phonemic based, and it uses small number of hand shapes known as cues that represent consonants, vowels, depending on where the cue is placed, whether it's close to the mouth, that's a vowel, or a little farther out from the face, which represents a consonant. That's less frequently seen. It's more so sign language or auditory verbal. But then we also can't forget about total communication, which is, I have quite a few kids doing this, which I love. They're taking an auditory verbal or auditory oral approach, but they're also incorporating sign language. And sometimes it's a matter of parents wanting their child to feel also part of the deaf community, not just the hearing world. So I love sign language. All the research backs up that it's really great to use, even for kids with typical hearing. But these are all systems of communication to discuss with the family. Definitely not something that you assume. Definitely open conversation from beginning to end.
Absolutely. And just so people are familiar, auditory verbal would be where it's just spoken speech and there's no extra visual.
Yep. Listening and speaking. Mm-hmm.
Perfect. Okay, so I like the idea of working with the families, because you don't want to, like she said, assume, okay, well, they probably just want to use auditory verbal because they're not in the deaf community, and then completely discount sign language when maybe that family is saying, but we really would like to incorporate some of this sign language. So if in same way, if you try to direct a child towards sign language and the family isn't willing to learn it, there's no point in doing that if it's not going to be across environments. So
absolutely, because then the only exposure they're getting to sign language is either at school or wherever you're seeing them for therapy. And when you're learning a language, you need to be engrossed in the language, as we all know.
Absolutely. All right. So you've got the background information, you've sat down with the parents, and you've talked about how is this child going to communicate, how are we going to communicate with him. Once you have all that decided, then we have the devices to deal with. So obviously we are not the ones fitting the child with devices. That should be an audiologist's role. But what is our role when it comes to helping manage these devices?
So for a speech language pathologist, you should be aware of what kind of amplification the child is using, whether it is a hearing aid, unilateral or bilateral, whether it's unilateral or bilateral cochlear implants, a bone-anchored hearing aid, what we abbreviate to the BAHA, and things that you should know are how to check the batteries, checking the lights on the devices, because lights differ from device to device. Sometimes a green light indicates that the hearing aid is working. Sometimes an orange light indicates that it's working. So you need to know what lights mean what, because sometimes kids aren't so great at identifying if their amplification is not working. Some kids are just distracted, some don't care, some haven't learned yet. So it's important for us to keep our eyes open too during all of this troubleshooting of the devices. Another thing to look for are debris and earwax in the tubing, things like that when you visually inspect the device, you can see if everything is clean or not. And another big thing is if there are missing pieces. Once you, if you notice that your child has the hearing aid over their ear, but the tubing is cracked or something's missing, they're not having that full auditory access that they need. So for speech language pathologists who don't have a lot of experience troubleshooting devices, I highly recommend finding a hearing support teacher. They typically walk around with their little kits of all the troubleshooting equipment, and a lot of times families have them too. So I would try and familiarize yourself with the little tools. There's tiny little brushes I've never seen that small in my life, little picks to get earwax out, all of these things that, you need to know how to use, because if the amplification isn't working, your therapy is not going to be productive.
Yes, excellent. So one of the rules of thumb I usually use is just every time you see that child, the first thing you do is check their device. Is that generally what you recommend?
Absolutely. As soon as you see them, if you're walking down the hallway, check to make sure those devices are on. They might just be in their backpack. They might be at home, wherever. You need to know that if they're on.
Yes. And you can always train teachers as well to do that once you figure out how to do it yourself. If you're in the school setting, teach those teachers how to do an equipment check first thing in the morning so that they are definitely benefiting from the education. Because if they can't hear the teacher, we're losing some good time there.
Big problems, yeah. And the thing is, it's very important for not only the teacher to check it, but for the speech therapist to do it, because batteries could die between arriving at school and 2 hours later when they're showing up to speech. So you can't just assume that everything's working and that the teacher checked everything, because everything might have been working at 8 a.m., but at 10 a.m., you never know.
Yeah. All right. So if you are on Facebook Live with us, stay tuned. We are going to do some giveaways here in just a moment, but we have 2 more tips for you. So you're started, you're ready in therapy, you know how things are going to go, but let's talk about what do we actually do in therapy to help this child. So the first thing we want to talk about for that is training them how to listen. Tell how that looks for you, Erin.
So I think a lot of speech language pathologists just assume hearing is just part of the deal. You don't have to necessarily address it or work on it too much. You just assume the child is hearing. But with deaf and hard of hearing kids, you can't assume that. Something I really want to emphasize is that listening is hard work. So typically hearing kids have been listening since birth. It's not as much of an effort for them, whereas deaf and hard of hearing children haven't necessarily been hearing since birth. They might not have been amplified since birth. Amplification is getting earlier and earlier, thank goodness, for kids and babies, little tiny babies. But this is something that speech language pathologists have to be aware of and have to incorporate into therapy, teaching children to listen. So there's a listening hierarchy that I always use in every session, even if it's just a warm-up. The first in the hierarchy is detection. Is the child responding to sound? If there's a fire truck outside, or if it's a sound that you're manifesting, are they responding by turning their head, moving their eyes? Are they reacting? The second step in the hierarchy is discrimination. So they're detecting sounds, they're responding to sounds. Can they tell if the sounds are different or the same? If you say peach versus pitch, can they discriminate that those are two different words? That's important to know. The next step in the hierarchy is identification. They can detect the sound, they can discriminate whether it's the same or different, but can they identify what that sound is? I hear a fire truck that sounds different than an airplane. Can they identify that as an airplane? That is a car. That is a cat. So that's the identification phase. The last in the hierarchy is comprehension. So they can detect, they can discriminate, they can identify. Do they comprehend what they're hearing? And this could be taking form of hearing directions, vocabulary, reading a book. Are they comprehending the words, the vocabulary, everything that you are saying? It's great if they can detect, discriminate, and identify it, but if they're not comprehending the sounds, then that's going to be a problem. And then I encourage all speech language pathologists to do what we call a listening check, and that is for the Ling-6 sounds. And if you're not familiar with the Ling-6 sounds, these sounds are approximately the sounds ranging from 250 hertz to 4,000 hertz on an audiogram, and they represent speech in the low, mid, and high frequencies. And this basically tells you what the child is hearing at that time. It determines the child's auditory access to speech sounds. Are they hearing low sounds? Are they hearing high sounds? And those sounds for the Ling-6 are oo, ah, ee, sh, s, and I can just boom them out. I've been doing them for years, but there's lots and lots of visuals online that can help you. And also, I always recommend to go to cochlear.com, advancedbionics.com. These are all brands of cochlear implants, and they have amazing resources for the Ling sounds and incorporating them into therapy. So I really recommend those websites. They also have therapy ideas, too, for speech pathologists.
So where does the Ling-6, where does that exercise fall into that continuum that you were saying? Are you asking them to identify which sounds they hear, or just do they hear them?
It depends on the age of the child. If they're really young, I just ask them to raise their hand or tell me that they heard a sound. And in order to ensure that they are hearing and they're not watching my face to know that I said something, I use what I call a auditory hoop. And you can make these on your own. Of course, I have one in my home office.
Of course.
And it's basically just a sewing hoop, and you get whatever fabric you want. And it literally takes 30 seconds to make. So then you just put this just over your mouth so that all you can do is hear me. You can't depend on any visuals. So for younger kids, I just have them raise a hand. I don't necessarily ask them to identify. But for older kids, I would say sometimes 3 and up, I ask them to identify the sounds, repeat back the sound that I said.
Perfect. Excellent. All right. So the last thing we're going to talk about today for working with our students who are deaf and hard of hearing is the therapy strategies. Erin, can you share a couple different therapy strategies that you use when you're working with these students to help them improve their communication skills? Absolutely. These are really simple strategies that you can incorporate, but it's very important that you do include them in every therapy session. One I recommend is reduce the distance between the child and you. If the child has a unilateral loss, know which ear is the best ear and sit closest to that ear for the best auditory access. Seating, that goes along with it. Where is the child sitting? Keep that distance short. Sit, if there's multiple kids in your room in a group setting, make sure that your seating is appropriate to the child with the hearing loss. And also make sure that the child isn't sitting in front of a window with a draft or anything like that. Things that you kind of forget about in a therapy room. I also recommend, especially with younger kids, maybe newly amplified, maybe not, keep your phrases short when it's appropriate, especially if there are any issues with the comprehension piece of the listening hierarchy. The shorter the phrases, the better and the easier the child's going to, help with comprehension. Another one is repeating yourself and making it subtle. If you're giving directions, we're going to play caribou because we all play caribou, and repeating twice, find the cupcakes.
Just something like that. And then to piggyback on repetition, asking the child to repeat back what you just said, what your direction was, to ensure active listening. Johnny, what did I say? Or what did you hear? To be sure that that auditory access is there and they're actively listening. And a couple others, auditory highlighting or acoustic highlighting. Let's say you're working on final consonants and you're talking about cherries in hi-ho cherry-o, cherries, highlighting that S. It could be highlighting vocabulary, highlighting specific phonemes, highlighting syllables. But that acoustic highlighting can be very important and helpful. A closed set versus an open set. Instead of asking a child with a hearing loss to identify an answer from an open set, keep it closed, give them 2 or 3 options. That way it's a little easier for them to answer. And then the last one is for some kiddos that need some visual assistance, whether it's signs, that's a whole other talk, but for those visual cues, we call auditory sandwiching, where you give the auditory cue or the word that you're talking about. Let's say you're practicing cherries, cherries, cherries. So it's a sandwich. And you can do that as needed and as appropriate throughout therapy sessions. And all of these together are really just reinforcing that active listening. Again, going back to listening is hard, and it is a really important part of the therapeutic process for these kids.
Wonderful. Yeah, I really like the auditory sandwich, even for children who don't have hearing loss. I use this a lot because a lot of our students need a visual paired with the language to be able to understand it. So if you give them the auditory first, make them think about it. Okay, what did I hear? What are we talking about? Then give them the visuals, like, oh, that's what it was. Okay, so they had a chance to process. Then they see what it is so they can really understand it. And then you say it again to reinforce that language piece. I think this is key for any child with a communication disorder, regardless of hearing status.
Oh, absolutely. Yeah. And I don't know if the delay emphasized it maybe too much, but it's just like you did, Carrie. You give a nice, generous pause between the auditory, the visual, and the auditory. All that processing, all of that reinforcement is going to help these kids.
Absolutely. Wonderful. Okay. We are ready to share some resources and do some giveaways, so stay tuned if you're here with us on Facebook Live. If you're watching this recording after the fact, you don't get to participate today, but join us on Monday afternoons on Facebook Live, and you can participate in the next one. All right, so favorite resource. What is your favorite resource for working with children who have hearing loss?
So I always have the Speech Banana laminated and ready for quick access. And here's the one. I don't know how well you can see it, but I have this from, again, Advanced Bionics, and it gives common sounds and where they fall on an audiogram. And to pair with this, I always have the most recent copy of the child's audiogram so that I can see what they're hearing, aided and unaided, whether the amplification is on or off. So the Speech Banana and then an updated audiogram, and I keep them within very close range.
Okay, and after we get off, can you put the link to that Speech Banana in the comments on Facebook?
Absolutely.
Okay, and if you're watching this recording after the fact, we'll have it in the show notes on speechandlanguagekids.com. All right, so now time for our giveaways. We are going to do 2 giveaways today. The first person to answer my question correctly will get Erin's giveaway. The second person will get mine. So Erin, tell us what you are giving away today.
So I always do between the ling practice and all the listening checks, I like to practice that active listening every session. And I really love this bingo game. It's called Sounds at Home, and it really encourages children to be listening to the sounds. Now, it's a little old-fashioned. There's an actual CD in this game, but I'm sure you could burn it onto your iPod or whatever everyone's using now. But it's common sounds from the home, from outdoors, and you have to detect, discriminate, identify the sounds. And on the bingo cards, you have to obviously put the chip on, and it just really encourages that engaged, active listening, and it's just a fun warm-up.
Perfect. Okay, and where can people find that if they don't win today's giveaway?
You can get this off of Amazon. Amazon is the best. Just look up Sounds at Home Listening Bingo.
Okay, perfect. And can you add the link to that to the show notes or to the comments afterwards as well?
Yeah, definitely.
Perfect. All right, that's the giveaway for Erin. I will be giving away 2 free months in my membership, the Speech Therapy Solution. If you're not familiar with that, that is my premium exclusive membership just for speech language pathologists. When you get in there, you will get access to training materials, ready to go therapy materials that you can print out and use right away with no prep. We actually set you up with a survival kit full of the no prep materials, so you're ready to go for therapy. We also do monthly webinars. We're doing one this afternoon, in fact, about speech therapy for Down syndrome. All kinds of goodies in there. So if you'd like to check that out, go on over to speechandlanguagekids.com/join to get the information. But the second person to answer my question is going to get 2 free months in that. All right, so here's the question. Are you ready, Facebook Livers? Here it is. For the Ling sound test, how many sounds are in the test? We want to know how many sounds are included in the Ling sound test. I didn't say it. I was so sure I was going to say the number.
Nice job, Carrie.
Thanks. So we'll give that a second. It takes a little bit of a delay here on the Facebook Live, but we'll see the first 2 people. All right. Fern Elise Reynolds says 6. Huzzah! Fern, you are correct.
That's right.
It is 6. All right. So, Erin, how do you want Fern to contact you to get her giveaway?
You can email me at speechpathwitherin@gmail.com.
Perfect. All right, and let's see. The next one is Lindsay Hall, had 6. All right, Lindsay, you are going to win the 2 free months in the Speech Therapy Solution, and you can email me at Carrie@speechandlanguagekids.com. Go to CARRIE@speechandlanguagekids.com, and my assistant Kenna will get you all set up. We had plenty of people chiming in. Wonderful. All right, that's our show for today. We hope that helped you out with your cases for children with with hearing loss. If you have more tough cases that you need help with, head on over to speechandlanguagekids.com/join to find out more about our membership. And Erin, where can people find more about you?
They can find more on my website, www.speechpathwitherin.com, and I'm over on Facebook at Your Speech Path LLC.
Perfect. All right, well, thank you so much for being here today.
Sure, thank you, and thanks everyone for listening on Memorial Day.
Yes, thank you all for joining us, and we will see all of you next Monday on the Speechie Show. I don't remember who's coming on, so it'll be a surprise. All right, thanks everyone, and have a great Memorial Day. Bye.
Bye.
Thanks for joining us today on the Speechie Show. We hope today's tips have helped you feel a little less stressed and a little more confident about your work. If you're looking for more stress busters and confidence boosters, we'd love to have you join us in the Speech Therapy Solution, where you'll get access to a huge library of premium training videos and another library of print and go therapy materials. You can also get help with your tough cases by joining Carrie on the weekly Q&A calls or by posting in the exclusive Facebook group. Plus, group members can join us for a monthly webinar that can be used for continuing education credit. Head on over to speechandlanguagekids.com/join to check out all the amazing benefits of the Speech Therapy Solution membership. Bye for now.